if I'm going to spend $60,000 a year on stem cells, I don't know, am I paying for hype or am I paying for real results?
Then the cancer cell can hijack the stem cell as well. They will hone in to the area where you have inflammation. But I never believe the aging can be reversed. Do you think you can live to 180 years old?
Or longer. Welcome to the Longevity Pharmacist podcast. I'm your host, Dr. Nayan Patel. Today we have Dr. Exosome here from Boston, Colombia, China,
Puerto Rico.
All right. So, a person from multi places, an author of the book, The Regeneration Effect. She's an expert in traditional Chinese medicine, using the concept and introducing stem cells to us. And we are so privileged to have her over here today. So thank you for joining our podcast.
I'm so excited to be here.
Thank you. I hear you're the 17th generation physician in your family.
Mm-hmm. Yes. So my great-grandfather up, they were all practicing Chinese medicine.
Okay.
In China. And some of them were court physician to the emperors in the old age. And then my grandparents on my mother's side, they were all practicing Western medicine. They went to Western medicine school. Actually, my grandmother went to the school set up by John D. Rockefeller Foundation in China. And I initially actually went to that school too when I was in China. And then my grandfather's younger brother was actually the private physician to Chairman Mao. And he wrote a book called The Private Life of Chairman Mao that was translated into English.
Okay.
And he wrote that book while he was in the United States in Chicago.
Wow. So we have somebody honorable here with us today. So thank you for sharing that part. So today we're going to talk about stem cells. I hear that you have dove into from TCM, or traditional Chinese medicine, to stem cells because it's the same concept. So tell me a little bit about how the transition went for you.
So I never really even thought about stem cells until 5 years ago, because I really didn't know about, you can use stem cells to do any treatments. But because I already had a place in Colombia, I started having my retreat in Colombia in 2018. And then I was introduced to a stem cell lab in Colombia, just by chance, not because I was looking for stem cell or anything. And then I visited the lab 3 times. I went into their culture room. They told me how they do all these things. So since I also had the background in growing tissue, cells, tissue culture, so I know these things. And then I was fascinated what they were doing. And then at the same time, my mother also had a condition in her leg that had not been able to be resolved for 2 years at that time. And I also knew her condition, if it was not treated correctly, it can grow into ulcer and eventually had amputation. So I knew personally, I know somebody's mother also had that similar condition. She even had experimental stem cell treatment in Boston. That's my patient's mother. And then it didn't work for her. Then she had some kind of stent treatment from the thigh area to blow the vein. And that really made things worse, blew all the junk into her feet, and she was diabetic. So then eventually she had to have amputation.
Wow.
So because of that, I actually researched about my mother's condition, and I thought, there's no proof that the stem cells could work, but why not try it? Because there's nothing to lose. And I certainly do not want my mom to have the amputation and stay in a wheelchair for the rest of, the remainder years she has. So that's why we did the stem cell treatment on her first from that lab in Colombia. And it worked really well for her. Within a month, that inflammation was reduced 90%.
Oh, wow. So what role do the stem cells play then? What role do they play, do you think?
I think the stem cells, actually, they can regulate the immune system. So according to, what I learned back then, or even like over the past 5 years, it really helps modulate your immune system. So if somebody has autoimmune conditions, that's because their immune system is overacting, right? So if you introduce the mesenchymal stem cells, they actually, supposedly there's some research showing like they react with T helper cells. So that's how they modulate the immune system, so that your immune system is not overacting. But then if your immune system is underacting, for example, in people who tend to develop certain cancer or something, because if, that's also before they develop the cancer. So before people develop cancer, if their immune system is not functioning correctly, so it's not eradicating the malfunction cells in the right time, then the cell overgrow, the malfunction cells, they accumulate. So that's also another side of the immune function. So I think the stem cell treatment actually can help either make overacting immune system less active so that they're not attacking your own tissue. And on the other side, they can also make your immune system acting more efficiently to eradicate whatever they need to eradicate.
Wow. So when you say stem cells, which types of stem cells are you using? Are you using adult stem cells, embryonic stem cells, pluripotent stem cells? Which one are you using?
So there are 4 types of stem cells.
Okay.
There's like a lot of people, they don't know, because when you mention stem cell, everybody thinks stem cell is stem cell. Why are there different types?
Yes.
So the ones we use are called mesenchymal stem cells, and they're not pluripotent. They are multipotent.
Okay.
So that means they can only grow into certain tissues like bone, cartilage, skin cells, or some of them can grow into neuron and some connective tissue. So they don't grow into everything. They cannot grow into a hard tissue or muscle, that type of thing. So they only grow into limited amount of lineage. That's why they're not tumorigenic. So that means they don't grow into cancer or tumor.
Okay.
So a lot of people, number one question people ask when they look into stem cell treatment is, oh, I heard stem cells can cause cancer. So if you only use mesenchymal stem cells and they're not contaminated with other types of stem cells, you're not going to get tumor from that.
Okay.
So that's a lot of people, they really don't know. And I've already explained that many, many times to different people. And then you have hematopoietic stem cells. That's in bone marrow.
Sure.
So those hematopoietic stem cells, they actually can become pluripotent. But most of times they're only grow into the blood cells, right? The red blood cell, white blood cells, that's the hematopoietic stem cells. And then you use hematopoietic stem cells to treat leukemia, lymphoma, and blood-related conditions. But you don't use hematopoietic stem cells to treat, say, joint or other things, because they can actually grow into tumor.
Okay.
Yeah. So sometimes, like mesenchymal stem cell, you can extract mesenchymal stem cells from a person's bone marrow or fatty tissue. And if you extract it from bone marrow, sometimes if you get contamination of hematopoietic stem cells, I think the reported cases that when people got stem cell injection into the joint, then later on they developed tumor in the joint. And then they tested the lineage of the cells in the tumor. And they found out that actually came from the stem cell injection they did, say 2 or 3 years earlier. And those actually, when they were using the stem cell, they were now using the mesenchymal stem cells from umbilical cord. A lot of times they use mesenchymal stem cells from bone marrow. And then that has a chance of getting contamination.
Is this similar to what people are using, the PRP, which is platelet-rich plasma, something similar to that?
No, because platelet-rich plasma is just concentrated platelets.
That's it.
But it does have some stem cells in it.
Yeah.
Because everybody, like when we were on the Antarctic trip, Christian was talking about, you use the herbs, and the herb can stimulate your bone marrow to release more stem cells into your bloodstream, right? So in your plasma, you do have your own body stem cells.
Okay.
So here's another thing, like nothing is really well studied or proven or anything, okay? But there's somebody also, or some people are saying, like, if you treat your plasma, your platelet-rich plasma with laser, red laser, it can actually stimulate some stem cells in the plasma. So it can activate them. So I actually, when I treat people with stem cells, we actually, a lot of time for joint injection, we would use platelet-rich plasma mixed with the stem cells. And then to obtain that platelet-rich plasma, I also treat the plasma with the red light.
Yeah, of course.
So that, whether it's proven or not, but if you think red light can stimulate the mitochondria in cells, then if you shine the red light into the plasma, I think that probably even stimulates some platelets or whatever is in there, right? So we don't know, but that's what I've been using.
Gotcha. So you said two. So you took hematopoietic stem cells and you talked about.
Okay. So then the embryonic stem cells, nobody uses that.
Okay.
Because embryonic stem cells is pluripotent and can grow into tumor.
Okay.
And also it's unethical because how do you get the embryonic stem cell? You have to kill the embryo, right?
Of course. That was my question is going to be is it ethically derived or not ethically derived stem cells, things like that as well.
And then the fourth one is induced pluripotent stem cells.
Okay.
So that is done in the lab. And then you actually can, this is something like pharmaceutical companies, they're looking into because you can control it. You can get a piece of skin from somebody and then use certain cell signaling molecule to induce it to grow, to become stem cell again. Because when you get the skin cell, it's no longer a stem cell. It's just the end result of the stem cell developing into the skin cell. But then if you use the lab techniques to make them become stem cell again, then it becomes induced pluripotent. So then some people, they're testing like using induced pluripotent stem cell to treat, say, Parkinson's. So then you have to implant that induced pluripotent stem cells into the brain. So you actually not only induce them into become pluripotent stem cell, they also induce them to become the substantia nigra cells so that they secrete both dopamine. Then you implant it into the brain. They become the dopamine secreting cells.
Wow. Okay.
So that's the other thing people are experimenting, but no
science.
No proven procedure has been successfully, used. But then there's also a case, I think there's somebody in Harvard Stem Cell Institute. They also use induced pluripotent stem cell to become insulin secreting pancreas cells. So then they can implant it into type 1 diabetes patients.
Okay.
And they said there was a case they did it. But how well it's been working since then, that was like 3 or 4 years ago. So I don't know.
Oh, really? Okay. Right. So
that's the fourth step.
Gotcha. Okay. So that's very interesting. So for me, I mean, most of my clients that I work with, they're pretty healthy to begin with. So my question is always going to be, is it stem cells really working at the cellular level? Is it working, is it reversing any aging process, or is it just helping boost your own immune system?
No, it's not just boosting the immune system.
Okay.
Definitely not. Because this is a real study that's already published. Because a lot of people, they're very concerned about using donor cells. Because when you get it from umbilical cord, it's from somebody else. Yes. It's not your own cell. So people always think, oh, my own cell will work better, right? But then your own body stem cell also age with you. So if you're 60, then your own body stem cell is also 60. So the confirmed published research is showing that if you extract your own body's mesenchymal stem cell from your bone marrow or fatty tissue, and then you grow your own body stem cells with umbilical cord matrix, cell matrix that has a lot of cell signaling molecules and has growth factors. But you have to grow for 3 generations. You have to grow 3 passes it.
Okay.
So that means you grow into one full flask, then you have to split it and then grow another full flask. So you have to do it 3 times. Then they say if you do that way, all the 3 passages, you're growing your own body stem cells with the umbilical cord cell matrix. Then after the 3 passages, 3 generations, you test the cells from your own body. So supposedly that your own body stem cell is, say, 60-year-old, right? The same age as you. But then after 3 generations, they found out the cells actually displayed the young properties. The properties as if they were from younger, from as if they were umbilical cord stem cells.
Wow. So that is available right now. We can use it right now.
Well, you can say, it's like somebody did the research, published it. They just try to tell you, like, actually it's possible to make your stem cells young again. So how? It's because you actually need the environment from the umbilical cord.
Okay.
Or from, embryo, wherever, right? So that environment, because your question is whether the stem cells is only boosting the immune system or it's doing other things.
Yes.
So what it does is actually that's why the part of the exosomes is from the stem cells. So the exosome also from the umbilical cord is try to wake up your own body stem cells. So when you get stem cell infusion or injection, it's not just regulating the immune system, it's also sending signals to your own body stem cells to wake them up.
Okay.
So then in traditional Chinese medicine concept, it is about supplying the energy to your body's original energy. So in traditional Chinese medicine, the whole origin of your body's life energy comes from the kidney energy. So if you think about it, like in Western medicine, the kidney is not just the energetic level of kidney organ in traditional Chinese medicine also encompass adrenal gland.
Yes.
So adrenal gland actually is the important organ for driving your life force, right?
It's a stress hormone.
Exactly.
Yeah.
So if you don't have adrenal gland, then basically your life is no energy, then you're dead, right?
Yes.
So the stem cells, when you get the umbilical cord stem cells, I believe, this is my theory, that's what I talked about in my book too, is actually supplying this fuel or extra energy to your body's original source of energy to give it a boost. So it's more like a battery jump starter in the car.
Of course.
Instead, then you need to jump start, right?
Yes. Well, then the question begs is that should we use stem cells for like a preventative system, or do we have to use for treatment options? Can anybody use stem cells on a daily basis? What are your thoughts for that?
I think you can. I mean, maybe it's an overkill if you use it on a daily basis.
Of course, yeah.
That's just too much, right?
Yeah.
But I think it's actually, if somebody is very healthy and want to do anti-aging treatments, but do not want to do 10,000 different treatments like Dave Asprey does, then, I have been experimenting myself. I've been getting stem cells every 3 or 4 months, something like that.
Okay.
So I don't have a lot of problems. I do feel pretty healthy, but I do feel by doing that regularly, it gives me the power from the stem cells and does have anti-aging effects for me.
Okay.
But of course, I don't have proof. So by the time I'm 90, I probably can tell people, yes, it's really working, right?
So you're not 90 yet?
No, not yet.
Okay. All right. So, well, in that case, I'm just going back to deeper now because this is very important to me, because if I say that I'm going to use every 2, 3 months, 4 months, that means 3 to 4 times per year, it can get pretty pricey.
Depends. I mean, if you say you get it from LA, yeah, it can be really pricey. But if you get it from the lab in Colombia, it's actually, think about some treatment from, like some anti-aging treatment you do, or I'm not talking about your pharmacy, or a lot of people like Dave Asprey type of people do.
Yes.
They actually spend $20,000, $30,000 in one treatment, right? Or even more than that. So if you do, say, 3 or 4 times per year with 100 million cells of stem cell infusion from the umbilical cord, if you get the cells from this lab in Colombia, which I believe is very good source and it's guaranteed quality, it's not no contamination because I've been getting it more than 30 times. If there's anything wrong, I will be the first person who get anything wrong, right? So then it's about like that one treatment cost to do some really fancy stuff you don't even know.
Okay. So in that case, can you tell me what is hype and what is real science behind stem cells at this point? Because if I'm going to spend $60,000 a year on stem cells, I don't know, am I paying for hype or am I paying for real results?
I think anything related to longevity or health right now can be either hype or real thing, right?
Okay.
Do you agree on that?
Well, most of the things are a bunch of hypes, right?
Exactly.
Yeah.
So because you think about it, yes, red light is really proven that it works, right?
Yes.
It works on cytochrome C. It knocks the nitric oxide out of the mitochondria chain so that it helps mitochondria to produce more ATP.
Of course.
However, you look at all these things on the internet, on social media, different people promote different devices. Which one is real? Which one is hype?
Okay. All right.
So are you able to tell which one is hype, which one is real?
We can't. And that's why I'm saying the stem cells right now, we have a lot of faith, or we are putting a lot of faith in that. And so my thing is just, I'm trying to understand, if my audience wants to go get stem cell treatment done, are they paying for hype or is it real science behind something that they can say, okay, at least it works with this thing?
Okay. Yeah. So for example, because if, let's say in Los Angeles, because that's where we are, and a lot of people will offer you exosome treatment.
Yes.
Okay. And when they offer you exosome, they say, oh, you get 10 billion exosomes. And then you pay $2,500 for it. But then 10 billion exosome is really nothing. It's a very small amount of anything. And also, even some companies, they don't even tell you how many exosomes are in the thing you're getting.
Because they can't measure it probably.
Well, they have to really measure the protein level, then they have to do the flow cytometry to really know how many.
But they don't know what the signaling molecule is.
Exactly. So, and then sometimes they actually just extract it from the umbilical cord or amniotic fluid.
Yes.
And then they didn't even know how many in it. So they just say, okay, this is the allograft flow through from umbilical cord. That's it. And that's actually what I saw yesterday because I met a woman who actually was on the Antarctica trip.
Okay.
She part-time she lives in Boston. So and she was the one who bid on my Exosome nasal spray.
Okay.
So I delivered it to her yesterday. And then she showed me what she got on the trip for the
stem cell treatment.
They say it's stem cell, but they didn't say at all how many stem cells. And then I believe I talked to people on the boat because some of them were told me like they went to the lecture and then they said the price for the $2,500 is actually for 10 billion exosomes. But somehow on the certificate, they didn't even say anything. They just say it's called umbilical cord flow through allograft. That's it.
Wow.
And then they just say, oh, we don't have any HIV, we don't have any hepatitis, no contamination.
It's a clean source.
That's it. And then other than that, they didn't even tell you what's the protein level. Because from this particular lab in Colombia, we also have stem cells, the exosomes. And then we do tell you how much. And they have the flow through chart to show you the protein level, the test, everything to show you that it is actually, that's the amount. So even that nasal spray I auctioned on the ship, it has 66 billion exosomes.
Okay.
So it's way more than like the 10 billion. If they say that one has 10 billion, I don't even know.
Got it. Okay.
Yeah. So would you call this hip or real thing? So for me, I would really like to know because I've talked to so many people and some of them, they say, oh, I got this treatment. And I said, how many cells did you get? They said, I don't remember. I don't know. And then like this lady, she got it on the shoe. I said, what did you get? She said she didn't know. And then she had to dig up the certificate, and I looked at it. I couldn't tell from the certificate.
Well, my pharmacist brain starts kicking in right now. Is good. Okay, I put a nasal spray of cells through my nasal passages. How's it get absorbed? I'm not sure how it's going to get absorbed. That's one question.
Mhm.
The second question I have is, if stem cells are they the actual doing the work, or are they producing signaling molecule to do the work? And if so, why can't you just use exosomes and not use stem cells at all?
So the stem cells are producing the signaling molecules inside your body. But when you get the stem cells inside your body, they actually will continuously release the vesicles, the exosomes. But if you only get exosomes without the stem cells, once you use a vesicle, it's gone, right? You don't have more cells releasing anything because it's acellular. So that's why stem cell treatment, if you get the stem cells instead of exosomes, you get longer lasting and more exosomes secreted from the stem cells. But if you only get exosomes, once you use it up, it's done. And then for the nasal passage, I think there are definitely research or several papers already published saying the stem cells can cross that cribriform plate.
Yeah, I read some of the research on those paperworks too. And yeah, it's crossing the plate, but I'm not even sure how it's absorbing at all. So that was my biggest question is I don't doubt that the results are there. What I'm questioning is that how is it getting absorbed through the system, which is it's not an easy one to absorb through these.
I know, just the same as glutathione, right?
It is.
So that's why they say for nasal spray, it's better to use exosome rather than stem cells.
Okay.
Because stem cells are 100 times the size of the exosome.
It is.
The stem cells are maybe between 10 micrometer to 30 micrometer.
Yeah.
But then the exosome is 150 nanometer.
That's right.
Okay.
Well, it's a little bit bigger than the glutathione because my research has been on glutathione for all these decades right now. And we figured out how to get glutathione through your system, bypassing all the layers. And so in my lab, we actually have exosomes research going on right now, trying to see if I can deliver use the same technology. Of course, it's right now it's in vitro, so we're just testing outside the human body at this point. But it's always been a question. Now, it may not be necessary to get absorbed in the system if it's just as a signaling molecule and the body gets the message.
Okay.
Right? You don't have to absorb it as long as you got the message also. So again, there's some intricacies over there that I don't understand.
So even like say stem cells you do through the nose. And if some of them do cross, get into the brain, right? And then they don't need to get into your cells like glutathione needs to get into the cellular level. So they can just flow around and then release. So the other thing about stem cells is they can actually, this is proven too, from like even 2017 research. So the stem cells actually, when they get into your body, they sense the signals from your body. So where you have inflammation, they also have signaling molecule released from the inflammatory sites, right?
Of course.
So then the stem cells actually are attracted to those inflammatory signals. So they will hone in to the area where you have inflammation. Then they can start releasing cell signaling molecules to help your body to do the repair, to reduce the inflammation.
Okay.
So then they don't need to get into any cells, And also, like some people, they are also concerned when they use the donor cells. Does the stem cell affect my DNA? So there's the vesicles, the exosomes. Some of them, they also say the vesicles contain mitochondria. So you have like really young 0-year-old mitochondria delivered to your cells through the vesicle. So that also increases the mitochondrial function, right? But you don't need the stem cells to go in there.
Okay. All right. Okay. That makes sense.
If this episode has been valuable for you in any way, please leave a review or a comment. It really helps more people to find more reliable, research-backed information in a space that's occupied with a lot of noise.
All right. So I'm going back to longevity.
Okay.
Because that's what my focus has been. I want to stay healthy as long as I can.
Okay.
And I'm looking at stem cell as one of the avenues that I can use to stay healthy for a very, very, very long time. And so my question is always going to be, if my healthy audience out there that is just healthy as a horse, that's 60 plus years old maybe, or even older, if they want to stay healthy, do you recommend stem cell treatments? If so, how often? If not, why not? And is stem cell the best option, or do you think exosomes is going to be better options for them?
So I think you can combine exosome with stem cells.
Okay.
And also for every person, it depends on the case, right? Not everybody is the same. So that's another principle I talked about in the book. Recognize your own body's constitution. So what does that mean? That means you can also check your genetic DNA background with the DNA test, right, nowadays. And you can also try to recognize your body's function type. Like in Ayurvedic medicine, you also have different types of bodies. So that's similar in Chinese medicine. You have to recognize your body type.
Okay.
So, for example, like in Chinese medicine, we've been using dried up placenta to nourish the body. So that's the same concept. That's why I said, the concept is not new. It's just the technology is new. So for that concept, if your body has a lot of excess, you actually are not suitable to consume that particular ingredient used in Chinese herbal medicine.
Yeah.
So, but then for stem cell injection or infusion, intravenous infusion, at least for now, I don't see that if your body has excess type, you can now do the infusion. So for most people, if they're very healthy in their 60s, 70s, and they just need some extra boost, more like a jump start to wake up their own body stem cells even better, and in combination with other things like red light or even like taking herbs to help release your own body stem cell from bone marrow, all these things combined together, then you actually can improve your body's function much better and then slows down the aging. But I never believe the aging can be reversed.
Oh, come on. That's what
Do
we're
you
here
really
for.
believe in that?
That's what I want to. That's what I want to hear.
So you think you can live to 180 years old?
Or longer.
You really believe in that?
I want to believe that we can. There's a potential that's out there. That's why my whole thing is I'm trying to figure out how can we live for a very long time, staying healthy. And I was hoping the stem cell can be the one that can help us reverse this aging process a little bit.
Well, I guess maybe we can see how long Dave Asprey lives first.
But the thing is, what if we restore all the pool for stem cells? You think that we can do that part? And if we can do that part, can we reverse aging process?
Well, if you do that, I mean, first of all, even though you get stem cell infusion every single day, let's say you get it every single day.
Okay.
Your body still ages, right? Like you don't, I mean, unless like, for example, that's why Dave Asprey has been trying to do all these gene therapy to really like change his own body stem cells genetics thing, because it's not like the stem cells you inject into your bloodstream will replace your own body stem cell. It's like they're just stimulating your own body stem cells.
True.
So then your own body stem cells still need to do the work. And then if they are still aging and they have not been 100% reversed for whatever aging-related DNA instability, DNA splicing, telomere. I mean, even though you do that, I mean, I don't even understand how they, they do the telomere genetic gene therapy using the CMV to introduce into cells, right?
Yep.
But does it really change 100% in your bone marrow, the stem cells you have in your body? I don't think so.
Probably not.
Exactly. So if you cannot change it 100%, how do you reverse?
All right. Okay. All right. So we hear all the good things about stem cells. Do you have some story about the dark side of the stem cells?
Mhm. Okay.
I
Yeah.
want to hear about what's the potential for negative reactions.
Well, if you have cancer,
Okay.
then you really need to be careful because right now it can be either way. It's very difficult to say whether this will help you or make your condition even worse.
Well, in that case, a lot of people may not even know they're cancer or not, even though because the diagnosis of cancers, most of the people when they find cancers is always a little bit later on than early on.
Okay. So that case, if you have not been diagnosed with cancer, you have not felt you have any nodule or anything. That means it has not been big enough, right?
Yes.
So in that kind of case, I think doing stem cells will help. That goes back to the initial we were talking about. It will
Okay.
increase the surveillance of your immune system to
Natural.
get rid of the natural,
NK cells.
exactly.
Okay.
Yeah. So in that, but then also I did a podcast with a guy, an engineer about red light.
Okay.
So when you use red light in cancer, it will increase the cancer growth.
Yeah, because the mitochondria.
Exactly.
Yeah.
So because the cancer cells can hijack that energy to grow faster.
Yes.
So the same thing with stem cells, because the stem cells release the growth factor, all these things to make your body function better. Then the cancer cell can hijack the stem cell as well.
Well, trust me, I'm very well aware of those kinds of scenarios because there's so much paper. Like for my example, I'm a glutathione researcher, and so for me, I get questions every single day. Oh, I hear glutathione is feeds cancer cells. I said yes and no. That's what we assume that it's doing. There's a lot of papers we publish along those lines. But glutathione is also known to increase NK cell activity, which is a natural killer cell activity, which just kills the cancer cells by itself. So you can't have both, right? And so there's a lot of things like those are like the depends on who's researching what and
Exactly.
what part of the are they putting on the study and not.
But again, let's go to the cancer again.
Okay.
I think this is my opinion, okay? So people eventually develop cancer because they have long-term stress over their body physically from the emotional stress. When they have emotional stress for long term, I'm talking about more than 10 years or 20 years,
Okay.
then that block the circulation, the irrigation system in your body, because one principle in the book is about your body is a garden.
Yeah.
So you have the intricate irrigation system to every part of your body and how it functions, and we don't even understand that fully. And then if you have long-term stress, then you will have blockage in the irrigation system. And in Chinese medicine, the cancer is considered the stagnation. When you have stagnation for the long term, that's when it becomes cancer.
Wow.
So it doesn't matter what we're talking about. So that's why it's very important to keep a very calm mind and reduce stress. That's actually the most important thing for anti-aging, right?
Perfect. Now that makes so much sense because that's what I was looking at right now. There's so much hype. There's so much unknown in stem cells right now. There's so much research that's been going on. Nothing's been published. Nothing's been available to the marketplace yet. Very earlier, this was talking about almost 18 years ago. I was working with a stem cell researcher in California over here. And in my compounding pharmacy, we were making basically products using these molecules, of course, for R&D purposes to helping these physicians out. And at that time, I mean, this was 70, 80 years ago.
That was very long time.
A very long time.
And also it was like an early stage.
It was an early stage. And of course, everyone was scared at that time. And they're still scared even today's day at this point. So having this knowledge that of how using what type of stem cells to use. So thank you for addressing those issues. What not to use, what can be used safely, even though it may not have the full benefit, that's okay, as long as it doesn't harm you is the most important part for us. And so whatever we know today is that's what I'm looking at right now. So in your opinion, if today,
Mm-hmm.
for me personally,
yes,
what would you recommend for me to do being a healthy, no problem. Or let's see if I have an issue. Let's see if I have a nerve issue
Okay.
where I don't know where the hell where this is coming from. Could be nerve endings, could be my legs, could be my brain. How would you do the treatments differently?
So for example, like you look pretty healthy to me, and you look very relaxed too. So you're not like really obsessed with things. So that's actually a very good quality, right? So for your case, if you don't have any joint problem, you have not worn out any joints, you don't have a lot of pain, then you can do stem cell treatment once or twice a year just for the intravenous infusion to improve your body's immune function, then the repair system, right?
Of course.
To help it regenerate that better. Okay. So, but then for somebody who already starts having some early symptoms, like I don't have a lot of problem, but I do have a knee injury that I already have for the past 15 years. And then I never had surgery for that knee, and I injured that knee multiple times, and I already found out it's complete ACL tear.
Okay.
Okay. So I don't want to do any surgery, and I can still do hiking, no problem. So why do I want to do the surgery? I don't want to do that. So I actually used a stem cell maybe 3 times 3 years ago.
Uh-huh.
And then after that, I didn't need to do any treatment for 3 years. And recently I did another treatment because I started feeling tiny, tiny bit of pain while I was going up the ladder to fix something.
Okay.
So then after that, I've been fine.
So it does have a healing capacity.
Yes. And then again, the earlier you do it, of course, the outcome would be the better because that's the early prevention principle, right?
Of course.
But most people, they want to wait until it's already, my doctor told me I need knee replacement. Can you help me?
Okay. So in that case, well, I lost my hair 15 years ago. Is it too late for me to grow my hair again?
That's a little bit late.
It's a little bit late. Oh my God.
Yes.
I was hoping to have something.
So did you lose your hair 15 years ago because of stress or just like a genetic in your family?
I don't think I have genetics in my family. I've been losing hair since I was like 22, 24 years of age. A very small amount. But then it just got worse. And then eventually one day I got a discount on my haircut. And he goes, oh my God, no. I'll just shave my head off. That was the end of the. Oh.
So you never tried these those other treatment like pharmaceutical things that they say like it can help grow your hair?
Well, no, because of most of the pharmaceuticals, I'm a pharmacist, so I understand the medication world and what kind of side effects I'm going to get from those, and I was not willing to tolerate those side effects.
Okay.
And none of the medications that are out there are side effects free. None, not a single one. So it means I didn't try anything.
Okay. Well, I guess, the hair is not that important. Maybe you look even wiser without hair. So I guess that part is not a big issue, right? But I do know somebody in your age, he said he did those, hair treatment, the pharmaceutical things they sell on the market.
Of course.
And he did it consistently. And then he actually did have some hair grow back. Like, it's not as thick, but it's like
the hair. There's some great treatments out there for hair growth, but something else have to pay the price.
Or you can do the transplant.
Yes.
Right?
Exactly.
And you do the transplant, but then after transplant, you can do the stem cell treatment to keep the transplant now being rejected.
So that's an option.
Yes.
I do have some hair on my side remaining, so I can use a transplant, and then I can use a stem cells.
Exactly.
Hey, that's an option out there.
Yes.
I may be seeing you in Colombia pretty soon
Okay.
for that reason. Yeah.
Well, actually, the doctor who works in my clinic in Colombia is specialized in doing hair treatment.
Oh, hey, maybe there's a trip coming for me, I guess, pretty soon.
But that hair transplant will take a lot of work to do, right?
I don't have the patience for that. I think I'm okay with having no hair, but this is just wondering.
Yeah.
All right. I think we've been talking for a long time about stem cells. So I just want to, in closing, if you have all the money in the world, with no ethical concerns whatsoever, how would you do treatments differently today?
I think I would still do the same thing I'm doing now. So basically, you do 3 or 4 stem cell intravenous infusion per year. And then at the same time, you can do hyperbaric chamber. if you can every day, then do red light therapy every day, 10 minutes with the panel that's strong enough, giving you strong enough reaction in your cells. And then depending on your body type, maybe do some treatment to address your body's inherent weakness and then moderate the excess, because everybody has that.
Okay.
Then just live happily, right? That's the most important thing, to promote the circulation. And then, the important thing is like get into the nature, connect to the earth, connect to the nature energy. That's the other thing. Yes.
Awesome. Well, thank you for coming over here. So please tell me, how can people find you?
They can go to stemcelltherapyexperts.com.
Okay.
And they can also go to Stem Cell Talk on Apple Podcasts, all these other podcast platforms. So I have my podcast talking about stem cells.
And please get her book, The Regeneration Effect by Dr. Yi Song. Thank you very much for coming on this podcast today. I appreciate your time.
Very nice talking to you today.
Thank you.